I welcome you all to today's video. So in today's video, we'll just be looking at the anatomy of the neck. So the neck, what do you understand by the neck? Okay, the neck is simply a quadrilateral structure that extends between the lower border of the mandible to the suprasternal notch and the upper part of the mandibular sternum, and also the upper part of the clavicle. So the neck is actually divided into two equal halves. Okay, it is divided into two equal halves by anterior midline. So each half of the neck contains an obliquely prominent structure known as the sternocleidomastoid muscle. So the sternocleidomastoid muscle divides each half of the neck into compartments, which is described as anterior and posterior compartments of the neck, anterior and posterior triangles of the neck. So the sternocleidomastoid muscle originates from the upper part of the mandibular sternum and then the medial third of the clavicle. So it runs upwards and laterally to insert at the mastoid process of temporal bone, and also laterally at the nuchal line. So the sternocleidomastoid muscle has action. When it acts, there is a role it plays. So its action, when both of the muscle, remember there are two in the body, okay, in each half of the neck. So when the two of these sternocleidomastoid muscle act together, they extend the head at atlanto-occipital joint. Okay, so they flexes the cervical part of the vertebral column, and when it is acting separately, it moves the face to the opposite side. Okay, so the sternocleidomastoid muscle actually is supplied by the spinal part of accessory nerve. Okay, the spinal part of the accessory nerve gives its motor supply. It is also supplied by the ventral rami of C2 to C3, which is proprioceptive. So the sternocleidomastoid muscle, as we can see, is an important muscle of the neck. It has its clinical implication. The clinical implication of sternocleidomastoid muscle is simply torticollis, or you can call it Wry Neck. Okay, like we said earlier, the sternocleidomastoid muscle is supplied by the spinal part of accessory nerve. So a situation whereby there is a damage to this spinal part of accessory nerve, it results to a condition known as Wry Neck or torticollis. There are actually three classes of Wry Neck. We have the congenital Wry Neck or congenital torticollis, you have the spasmodic torticollis, and you have the muscular torticollis. In congenital torticollis, it is as a result of excessive stretch of the neck during childbirth. Also, when there is a nodular cyst in the substance of the sternocleidomastoid muscle, it tends to prevent the sternocleidomastoid muscle from contracting properly. And also for the muscular torticollis is when there is a physical damage to the sternocleidomastoid muscle. So that is what results in muscular torticollis. Then for spasmodic torticollis is as a result of intermittent uncontrolled contraction of the sternocleidomastoid muscle. So it's as a result of stimulation of the spinal accessory nerve. So the spasmodic torticollis is actually it is actually connected with madness. Okay, it's connected with it is psychogenic, so it is connected with madness. So this is just an introductory class to the neck. So this work is actually it is coming from the lecture material of my lecturer, Dr. Ogugwa Ego, a lecturer in the Department of Anatomy, Alex Ekume Federal University in Dufalike, Iko. And you can also check more. For more information, you can go to your last textbook, last anatomy, and other materials. Thank you for your time. Bye. See you some other time. Peace.